Hello, everybody, and welcome to yet another edition of the Middle Georgia Spotlight. I'm your host, Jack Ellis. Thank you so much for joining us in the Spotlight this week. He's been in the Spotlight more ways than one for the last couple of weeks, and that is the President and CEO of Mercer University. I said CEO. He's the President of Mercer University. I guess the CEO, the Chief Executive Officer. He's both, and I'm sure he's been very busy. Thank you, Mr. President, for joining me.
Mr. Mayor, it's great being with you as always.
Well, my question, how are you?
I'm good. Yeah, I'm good. This is, it's an interesting time, interesting challenges, things that none of us have dealt with before, but we're getting a chance to prove we can deal with it now.
Yeah, you were on top of this early on in terms of shutting the school down, sending students home. What informed your decision? Was it the medical people, or did you? What informed your decision to make such a not hasty, but such a quick decision?
Well, I don't think I was quick. In fact, we didn't make the decision to close our in-person classes until several days after the University System of Georgia did. I was very reluctant to do that. I believe in what we do. I believe in the residential model of education that we promote. And it was really with tremendous reluctance that I accepted that we were going to have to move to a virtual model. Even when we made the decision to move to a virtual model, I said, we'll do this for a few weeks and then revisit and see if there's any way we can get back to the model we believe in. And it was only when it was apparent to me that we weren't going to be able to resume ordinary classes on campus that I made that call. But I don't think I was early to it. I think some people would tell you I was late to it. And again, the reason for my delay is I believe in what we do and how we do it. And I was just very, very reluctant to abandon it.
Was that your call, independently, or did you have to, like I said, you're the president of the university, so you don't have, I guess you're a board of directors, but they're called the trustees. Did you have to consult with them, or this was strictly consulting with department heads, professors, and your call?
No, I made recommendations to the trustees, and they accepted my recommendations. But I suppose ultimately it is the call of the Board of Trustees of the university. But in this case, they accepted my recommendations every step of the way, and that's where we are today.
Yeah. Well, being this time of year, I'm sure you had to weigh safety against, because your main mission to educate young minds, especially undergraduate, but also postgraduate and so forth. So, children go here for 4 years. I know when my daughter was in school, I looked forward to going to her graduation and that. So I'm sure you had to weigh that because parents, probably some had bought tickets already coming from afar, preparing for graduation. How much did that weigh on you?
Well, there are a lot of things to weigh, and let me give you an example. Safety and health of your students always has to come first. That's a complicated question. Because of the different circumstances of students we have. I had parents who are frontline healthcare providers back at home in their communities. They would call me and say, don't send my daughter home because it's going to be riskier for her at home than it is if she stays on campus. I had students who came to me and said, I have an 86-year-old grandmother that lives in my house, and I'm afraid to go home because I'm worried about her and the impact of having people around the house on her. So, even health and safety is a complicated question in this situation. Initially, what I wanted to do was leave it to each student to evaluate their own circumstances. And those that felt safer going home would be able to complete their courses online. Those that felt safer here could stay on campus and complete their courses on campus. That didn't work. Lots of folks felt that students staying here would be an advantage over those going home, and that was unfair. Some people felt that that wasn't giving adequate consideration to issues like are we going to be a burden on Macon hospitals? So ultimately, the decision was we're going to put everybody online. But I haven't required everyone to leave Macon. Not that I could do that anyway. I'm still allowing students who have a good reason to remain to be on campus. Those students
To stay in the dorms. Even.
Yeah, those students whose parents have called and said, it's dangerous for my son or daughter to come back. Can they stay? I've said yes. Those students who have said, it's dangerous for me to go home for the people, my parents or grandparents who are elderly. Can I stay? I've said yes. We have international students who are under travel restrictions who can't leave. Or for whom it's very dangerous for them to leave. And I've allowed them to stay. So the overwhelming majority of our students have returned to their homes, but we have some here who are staying for the kinds of reasons I've described.
You mentioned an unfair advantage for the students studying online away from the university.
Disadvantage.
A disadvantage.
Right.
A disadvantage. And not necessarily unfair, but a disadvantage. But I was listening to NPR, National Public Radio, a couple of days ago, and they were saying that marginal students who are struggling somewhat, probably would be most disadvantaged by being online as opposed to the student who's doing well and so forth. What kind of consideration would be given to grades, if you will, professors? What type of leniency will they have for students who maybe just don't do well on online learning?
The faculty are aware of that, and I think they're appropriately sensitive to that concern, and I think that concern is going to be taken into account. We're evaluating providing students the option of taking some of their classes pass-fail this semester in recognition of the concern that you've described. We've got lots of considerations to look at. Will a pass-fail class count when they're applying to medical school or some other graduate school? We want to make sure that there's not some unintended adverse collateral consequence for a student who chooses that option. How will that affect their eligibility for the Hope Scholarship? We're having to look into that, because the last thing we want to do is have a student say, I'm going to elect to take this class pass-fail, and then be hurt by that decision.
Well, Mr. President, I asked a student, I said I was going to told him, as well asked 2 or 3 students, what the gentleman said. I said, what if I'm going to interview the president of Mercer University? One question you like to ask, he said, will there be a refund on my housing allowance if I'm no longer staying in the dorm for this semester?
Yes.
Oh, it will be, okay.
There will be a pro rata refund on housing and board as well if they've decided to move home. Sure.
Well, great. Well, in addition to being an educator provider, you're also a healthcare provider. You have a medical school, you do telemedicine, you have Mercer Medicine. How have you been able, your staff been able to interface with the caregivers, and what role are you playing? I know you've been doing telemedicine. People are talking about telemedicine now, but the last time you were on the program, you said you set something up in Plains, Georgia, where you had telemedicine going. Has that been expanded? How much of a benefit has that been?
Yeah, we are a provider. We have our clinic here in Macon that's downtown. We have a clinic in Plains. We have one in Fort Valley. We're about to open a clinic in Fort Gaines. We've established a telemedicine network. We just this week released an app that rural physicians around the state can put on their phone that allows them to access telemedicine facilities on behalf of their patients through their phone. And I think that's going to be an important tool, especially for helping primary care physicians evaluate whether a patient is presenting symptoms of this virus or not. They can consult with one of our infectious disease experts and get their opinion as to whether the symptoms they're seeing in the patient suggest exposure to this virus, and if they do, what course of treatment the infectious disease people are recommending. And I think all that's going to be helpful. We need more testing capacity in this community. And we're working hard to develop more capacity to give people tests so they can find out if they've been exposed and infected or not, and find out quickly. There's some new technology that's been developed by a company called Abbott Labs. It's a small portable testing system that can provide results to people who are tested within 5 minutes of being tested.
No more 5 or 6 days, 5 minutes.
No more 5 or 6 days, 5 minutes. We don't have any of this equipment in Middle Georgia, and as you can imagine, there's tremendous demand for it all across the United States. So we're pursuing avenues now to see if we can get some of this technology available to folks here in this community, because I think that's maybe the most important current tool we could have to move through this healthcare situation, is to get people tested and get them immediate results. And they can find out if they're carrying the virus. If they are, we can get them appropriately quarantined or isolated until they're through it, and then keep an eye on folks that have been around them. But we just don't have the testing capacity we need in this community.
In case you're just joining us, we're talking with President Bill Underwood, who's the president of Mercer University. As you can see, the beautiful campus here behind us on the backdrop. So, but it's not just here. Campuses in Columbus, there are campuses in Savannah, campuses in Atlanta, and maybe other places I'm not aware of. But I understand that you've had a couple students, at least one, tested positive for this virus. Was it here on this campus or one of the other campuses?
It was a graduate student who was last here in Macon on March 18th. They went home to Atlanta, and after they'd been home for 9 or 10 days, they developed symptoms in Atlanta and have since tested positive there in Atlanta. Obviously, there's no way to know whether they were exposed to the virus while they were still living off campus here in Macon, or whether their exposure came when they returned to Atlanta. But I understand she's doing well. She's at home, and hopefully by today she's worked through the symptoms and begun her recovery.
Well, it's not all, some good is coming out of this as well. It's kind of hard to, when you see so many people infected and affected and dying and so forth. But I was reading, I guess it was online or something, where you had given it, maybe it was on, I follow you on Twitter, where you had given a shout out to some engineers on your school that developing masks, already producing them.
Sure, we've got, nationally we have a shortage of really high quality masks. They call them N95 masks for healthcare providers. And one of the potential solutions is using 3D technology, 3D printers, to create your own reusable masks. These are masks that are made from very durable plastics, and you simply periodically change the filter on the mask. And they've now developed the mask. They've shared the technology with anyone who's interested in it around the country. We're using an expedited FDA approval process to get approval for people to use the masks. We want to make sure that everyone agrees these masks work and they're safe and we're hoping to begin getting these masks out into circulation in the next few days.
What other type of innovation and things, because they say the necessity is the mother of innovation, and of course you have an engineering school, a medical school, and all the other kinds of schools. What are any other type of innovations coming out from the medical school, as well as in addition to engineering school, that we're not aware?
Well, something else that the engineers are working on using our 3D printer capacity, both on campus here in Macon as well as at the Mercer Engineering Research Center in Warner Robins, is developing face masks for the healthcare providers, because one potential source of infection and exposure for those providers is when patients who are positive sneeze into their face and so forth. So there's also a shortage of these shields that go over their eyes, and we're using our 3D printers to begin producing those as well.
So the student, especially the undergraduate, now you close all things, medical school, law school, everything is postgraduate.
We have closed all the in-person classes.
That's what I mean.
They're all online now.
Okay. What advice would you give to parents and or students how to deal with this new phenomenon of online? We spoke earlier about how some people feel it's an advantage or disadvantage depending on what side of the fence you're on here. But what's your advice to students and parents?
So one, this is temporary. We'll get through this in a few weeks. I think we're fully aware of the disadvantages of online. The most important thing is to find an environment where you can study without distraction. If you have that at home, that's great. If you don't have it at home, you need to look for a place where you can have it. If you're here in Macon, our libraries are open still, and there's lots of study space there, and I would encourage people to take advantage of it. If you're not here in Macon, you need to find a place where you can have the kind of quiet you need to concentrate.
Well, you know, obviously, sports is a big part of any university setting, and I'm sure, you know, canceling the NCAA was a big deal with the presidents of the various universities. Were you involved in, did you have any option once the NCAA said it's shut down, you couldn't have kept your league going? It was a nationwide thing, I guess.
It was. And of course, all of our spring sports were canceled about halfway into the season, which is you regret it for the young men and women who've spent their lives preparing for this opportunity, but I think that was the right decision to go ahead and cancel the sports for the remainder of this season. The NCAA has now decided that for those student athletes that lost this season in their spring sport, they'll get one extra year of eligibility so that they'll be able to complete that season next year if they choose. You know, for many of the seniors, people forget most of our student athletes are students first.
Yes.
And many of our graduates this year are going on to medical school or graduate school or law school, or they've accepted jobs. And even though they have the option of coming back for one additional year, many of them will not take that option. They'll move on with their lives, but some of them will, and it's good that the NCAA has created that option for them.
This is a medical emergency more than anything. Obviously, it's a financial disaster for a lot of people, but first and foremost, it is a medical medical emergency. So, you have a medical school that was created for the purpose of serving the underserved in Georgia, rural Georgia primarily. What we have noticed out of this thing, especially looking at the statistics from Albany or something, is that most of the people who are affected and that's dying, not affected, dying, are people with very poor health outcomes. Some didn't have a doctor. Has this kind of opened our eyes to providing Medicaid for all, if you will. Will you be champ? Will this? You think this will open the dialogue that you can say to the governor, "Hey, it's time to expand Medicaid for all in this. Make sure everyone is covered here."
Well, there's no doubt that the people who are most exposed to this virus are people who have pre-existing health challenges, whether it's diabetes or pulmonary issues or heart issues, heart health issues. Those are the people who are most vulnerable. And it's also true that large numbers of those people live in rural and underserved communities in this state. And I think what this emphasizes is how important it is to create a healthcare delivery system that's accessible to people in rural and underserved areas. We've started these clinics, Mr. Mayor, the one in Plains first, then we have one in Fort Valley now. We're creating a third in Fort Gaines. That's the tip of the iceberg. I'd like to see 30 of these clinics focused on our most vulnerable populations in rural and underserved communities in this state, because I think this virus does reiterate the importance of addressing the health status of people in these communities at an early stage, because that health status does make them vulnerable, not just to this virus, but to any number of other things that can arise.
Our governor, and I know that you steer clear of politics, like people stay away from skunks, as they say, but you have a voice as a thought leader and as a university president with several campus throughout the state. What would you say to Governor Kemp while most governors are closing down the state, telling people to stay home? What advice, if he would ask your advice, would you give him?
I would advise him to talk to people that know more about it than I do.
I said you would stay away from politics. You're a diplomat, that's for sure.
Well, I mean, but that's true. I'm not a healthcare professional. I'm not a physician.
But political decisions of people, that, for instance, our local mayor made a decision to do certain things. Did he consult with the medical community? Or was that what kind of, I wonder, maybe I have to ask him.
I don't know. I'd have him come on the program
I'm trying to.
Because I haven't done that, yeah.
But as you said, your decision, you consulted with the trustees, and I'm sure you consulted with medical, looking at the best medical advice around.
I spoke with our two infectious disease experts in the School of Medicine, who just happen to be two of the best in the entire Southeast.
At Mercer University?
At Mercer University, and it was very helpful for me to get input from them. It was very helpful for me to talk to the Dean of the School of Medicine, who's one of the finest primary care physicians and rural medicine physicians in this region, Dr. Gene Sumner. And I've tried to get input from people that really do know what they're talking about. And the only advice I would have for any of our governmental decision makers is to do the same. And I suspect they have. You don't hear the same thing from every healthcare expert you talk with. And there are things that have to be balanced. I think our primary concern is the health of our population. I've got a long-term concern about the economic health of our population. I know a lot of the people here in Macon who have lost their jobs. Most of them at this point are hourly workers who live paycheck to paycheck. I worry about those folks. And I worry about the impact of a prolonged economic downturn
on those families.
On their families.
Yeah.
So I know for certain that these are really complicated decisions. And I'm reluctant to criticize people who I think are trying to do what they think is right in weighing lots of information, lots of advice in what is a really complicated situation.
Which would lead me to your question.
Which is what you used to do when you were mayor. I watched you. You listened to lots of people. You got advice from the best sources you could. Frequently that advice pointed you in different directions, and it was your responsibility to weigh it all and come to the best decision you could. And I suspect that just about every controversial decision you made, you were trying to make the best decision you could based on the best information available to you. And on every one of those decisions, people disagreed with you and were angry, and people agreed with you. But these are complicated questions.
Which leads me to my next question. In addition to faculty members, people with PhDs and medical doctors, you have a lot of blue-collar workers working on that university campus.
We do.
Are they going to be taken care of? Were they sent home? Will they continue to get their check, or will they be dependent upon the federal government's stimulus package that's coming down?
I guess you could call them blue-collar workers, but for
non-academicians, I guess.
Yeah, we haven't laid off any Mercer employee to this point in time, as of today. I do worry about some of the people who work for folks that contract with Mercer. I don't think they're all still employed, and that's why I say I do worry about the economic impact that this has on lots of hourly workers.
What about the university itself? In terms of course, you still have the physical plant to deal with and operate.
Yeah, they're all still employed.
Yeah, but I mean, will there be less revenue coming in, or will you be saving money because, for instance, students are gone, you're not operating the sports, the spring sports. So I guess there'll be a savings as well as expenditure.
Well, so far there haven't been any savings because everybody's still employed. You asked me a few minutes ago if I was refunding room and board. Well, I am. The unused portion of the room and board. So that's several $1 million. I've got to find a way to cover that several $1 million. There aren't going to be savings that offset it.
My last question, what keeps you up at night at times like this? Like I said, these students, of course, are most important. You know, you got the parents. They send their students to you at 18, and you're responsible to them to the live. But what keeps you up at night and during times like this?
Not understanding what the end game is on this virus. What's the trigger that tells us it's okay to go back to work, it's okay to go back to school, experiencing something that we haven't had experienced before, and thinking about the consequences, certainly the health consequences for the most vulnerable members of our community, the consequences for the students in our public school system who I think, despite our best efforts, are losing a significant part of this year's education. Worrying about the people that work at all these restaurants around town who have lost their jobs. Worrying about the small business people who operate on thin margins. Who are losing their businesses. I mean, there's a lot to keep us all. That's a lot to keep us all awake
And I think one of the most important, not the most important, but one thing that you said, that you're concerned about not just your students, but the students in this community in public schools, because in addition to being your future product, they are part of this community, and it's very, I thought that was a profound statement that you would be concerned about them. And next week, to that end, next week I'm going to have the president, not the president, but superintendent, Dr. Jones, on this program to talk about.
He's tremendous.
What's
I can't
going on.
imagine a better leader for our schools than Dr. Jones, and I guarantee you that's a man that's having lots of sleepless nights right now.
Well, people would say the same thing about you, that we could not have a better man at the helm of Mercer University at a time like this, and we thank you for your leadership.
Thanks, Mr. Mayor.
And thank you for your
Thanks
leadership,
for having
and
me.
thank you for being with us. We've been talking with Bill Underwood, who is the president of Mercer University here in Macon, Georgia, with campuses throughout the state of Georgia, and we thank you all so much for joining us. Stay safe. If you notice, we have our 6 feet apart here, so we're practicing. We did not shake hands, and we're not going to shake hands, but I wish him well, and I wish each and every one of you well. Stay safe. Until next week, I'm your host, Jack Ellis. Goodbye.